to actually leave military service, mostly because they weren't able to maintain a lot of the things related to their health. And so what I learned in my job was that there was definitely a what I consider to be a health disparity within our service branches, despite having access to care, despite having all of these great things that we think about in military medicine. We still sort of had this racial disparity among young African Americans who were predominantly those who were the incident cases that I was seeing, and I was really bothered by that. We also had a disparity in folks who are seeking some of the preventive services. So if you haven't heard of PrEP, pre-exposure prophylaxis, and so that was to me something that personally I wanted to try to figure out how do we do something about that. How do we actually make policies that really address this issue? I think that if we hadn't brought it forth, we wouldn't have the access that we think we should, or that was comparable to what you might see on the outside, and maybe even a little bit better in terms of people being able to get access to the medicine, and things like that. In terms of other things, my personal experience, um, I think when I first came into the Navy, I would say that, that 25 years ago, as an African American female, I was still one of the only ones in the class, one of the only ones, in my intern class, one of the only ones in my entire residency, and often the one who was mistaken to be, not a doctor when I walked in the room. And over the years, I've had a few instances, but in general, I still feel that the Navy has tried. I don't know if people have seen the recent report that came out recently, where they're looking at diversity and inclusion, and there are lots of things that need to be corrected and fixed. Um, but in terms of that, I think many of our physicians have tried to make sure that we are delivering equitable care. But I think systematically, there are definitely areas we can fix. I don't know if I answered that really broad question, but I'm giving you sort of um, some of the things that I think are at least important to me, and I'll turn it over to somebody else to see if they had a better answer than I did. Over.
I can speak just on my thoughts. I agree with everything Captain Beckett said, and I know for me, when I think we all know that sort of in regards to representation, there just isn't that much in regards of like Black and brown people being represented in medicine, and that's one thing I wrote about. I wrote about this in a publication that I had submitted to a psychiatry journal. I just talked about my experience as a person of color being in medical school and how I thought that affected me and growing up and stuff like that. And even now, Dr. Said and I are working on getting a screening of Black Men in White Coat, which is sort of a documentary that depicts, the importance of having the diversity and inclusion in the field of medicine and how it improves healthcare outcomes and all those things. And so I will say the one thing about USIS that I like is that you're able to really enact change. And if you're interested and passionate about a project, you can, find a mentor or find somebody that you're able to work with, and you can hopefully bring that change to the school, because there's a lot of people who, want to enact quality change to sort of minimize disparities and discrimination and racism and all those things that are very real and that affect healthcare and medicine. And also the last thing I'll say is that I found a great sort of crew and group of friends here that I'm very close with, and that I think have largely formed like a core group for myself. So that's sort of how I deal with all that stuff.
I'm happy to speak on it too. As far as for the kind of patient care standpoint, so for me as a pediatrician, I will say Anecdotally, I have noticed kind of discrepancies and inequities regarding care. When you think of the military population and the fact that they have the access shouldn't be an issue, and sometimes people think, well, if access is not an issue, then you shouldn't have some of the same things that you're seeing on the civilian side. But unfortunately, that's really just one of the many kind of social determinants of health to consider when you're thinking about kind of the patients and their different backgrounds and their different experiences. And so what I've noticed is sometimes it has nothing to do with access, but it has to do with healthcare literacy and do they know how to navigate the system? And even I find, for myself as a physician, knowing how to navigate the system and having my own family, sometimes that can be challenging. So I could only imagine for somebody without that background, how challenging that might seem for them. And as far as kind of my personal, my personal experience navigating my career thus far, I always describe it as such that, whether it be USU or military medicine or the military, it's kind of a subset of the US, the nation. And so the same issues that you're going to have outside of the military, you will see within the military, you will see within military medicine. But what I can say, what I can echo is, particularly now, there's definitely been a lot of intentional kind of planning and intentional kind of changes regarding improving some of those experiences and improving so you don't have as much issues regarding overt discrimination or prejudice or racism within the military and within military medicine. So particularly at USU, there's a lot of work within student groups, but also within leadership level as far as how to be mindful of the experiences and what the students are navigating through and taking that into account as they kind of make changes and make decisions moving forward.
Thank you, Commander Saeed. Ensign Koljat, did you want to speak at all in regards to this?
Yeah, I actually really wanted to emphasize what Commander Saeed was saying about a lot of the issues that we have are not always, sorry, I just completely had a loss of train of thought. So with the aspect of health literacy and communication, that's something that I've personally found my time, even when I was teaching health education on the south side of Chicago, that even though we speak the same language of English and maybe not as a primary language or learn as a secondary language, there can still be that disconnect between the patient and provider. And so I think even at USIS so far in my early career as a medical student, they've done a great job at trying to work about helping people develop the agency to take charge of their access. And especially as Commander Saeed was talking about how we shouldn't necessarily be having these issues with everyone having equal access, but yet we still do. And so trying to address those issues through the provider mentality is something that I think has been a pretty big emphasis while my time here.
Thank you all for speaking about that. I know a few of you have mentioned about how USIS has combated some of these different issues with healthcare. Does anyone else want to speak about what they think the school is doing in regards to these issues?
This is Captain Beckett again. I failed to mention that I did get a master's in public health at USU later in my career. And during that time, just, understanding sort of military medicine and how we sort of fit in the mold of what others do on the outside was interesting. And I learned, that, there was this massive thinking out there that we don't have disparities. And I thought that was just pretty amazing. And I think that over the years that has improved. And I think that, we have a lot of focus on global health and tropical medicine and all these other things that are important to our missions. But, in terms of how we take care of our folks and their families, I think the school has tried to figure out a way to have better emphasis on those things. And not being attached to uses directly. I'm actually one of the associate professors, and so I'm as in tune to all of the initiatives that the university is taking. But I think that they often are trying to find ways to develop research initiatives that will help improve things. We're not the NIH, but yeah, I think there are ways to collaborate and figure that out. I know that I think that the university does care about its students and making sure that there are groups on campus that speak to the issues that are important to students. And in the last few years, I've seen a very active way of making sure that those groups are supported and that they have representation on the campus.
And I'm happy to speak on some of the things that are going on campus, even most recently, to address the question. So I know there's hopefully I don't get the kind of abbreviation wrong. I think it's SWAB, so Student Wellness Advisory Board. And through that board, which is all, not just School of Medicine students, but all different kind of schools that are at USU, there's a diversity, equity, inclusion task force that puts on a lot of different events and activities. And most recently, they're doing kind of this lecture series that's open to all. So not just the students, but also open to the faculty with very engaging kind of like outside guest speakers coming in to discuss some of these topics and have, really open discussions regarding, concerns that come up and even kind of just ideas or thoughts as far as, ways for improvement if there's an issue that shows up. So that's one of the things that's happening. I know Derek alluded to the fact that through working with SNMA, we're also hoping to do kind of a screening of the film Black Man in a White Coat to kind of increase the visibility on the issue regarding lack of, diversity when you look at kind of, how many the fact that we don't have a lot of minorities within medicine. So as far as underrepresented minorities in medicine, but particular African-American males. And regarding, there's a lot of also courses. So some information is put within the curriculum, but also there's courses that students can take that are open to all, not only the School of Medicine students, but other classes that, for instance, right now I'm doing an iteration of racism in medicine that's open to not just School of Medicine, but also GSN and also GO. So where we can kind of collaborate and have these discussions and learn about things that are, taking advantage of the distance learning, the virtual sort of platform that we find ourselves in. So different ways like that to kind of input things within the curriculum, making things optional. I know there's a lot of reflective practice sort of topics that are built into the curriculum that I don't know if the students could speak to more of the specific topics that they discuss to ensure that discussions are had kind of on different DEI sort of initiatives.
And sort of jumping off what Dr. Saeed just said, I took the distance learning course, Racism in Medicine, and it was a great course. I believe it was the brainchild of one of my classmates in the class right below me, Dr. Saeed. And so that's just another example of how like you as a student can enact change. If you find something our curriculum is like deficient in, that's something you can take advantage of and change and be proactive and advocate. And I'll give two other examples. I have another classmate who found that there was, a deficiency in sort of implicit bias education and training in our curriculum and in the School of Medicine. And so she, along with another one of our classmates, actually developed sort of a curriculum for it, and it's being implemented into the, all the classes below us. And so they will have that ability when they're going through their clerkships and also in their residency to have that sort of knowledge in their back pocket. And then also, one of my friends in the class above me, he found or thought that there was sort of a deficiency in lesbian and gay and transgender medicine, and how those individuals, how we're taught about healthcare and how it applies to them. So he developed a curriculum for those individuals, and that's being implemented for my class and everyone else. So there's so many things that you can do and you can implement if you find that there's a need, and I think you'll always have the support at USIS to implement it.
I cannot express enough the amount of support that there is at USIS to push individuals to go after and make change. It was actually Commander Saeed who helped me, motivate me to create a new LMSA chapter here on campus. And so if you find a deficiency anywhere in the education or anywhere at all, the faculty is beyond supportive and will actually push you in the right direction, create those connections, and help make change. And like we were saying earlier in our curriculum, we do have these reflective practices that go on. And if student organizations feel like they want more or something necessary, our Office of Student Affairs is actually really receptive to that. We actually had a meeting last month with all of our organizations to figure out where the education is deficient or what could be changed, and extremely receptive about that. And we're going to be constantly having those. So I would say that if there is an issue, the issue is that they're asking for too much feedback. You'll get tired of all the emails for saying, oh, we want feedback, we want feedback. And I will say the amount of emails I get a day are insane, but it's a good thing. So I don't think that our school is turning a blind eye to these disparities. And if anything, they're being leaders by tackling them head on and trying to get the students' input onto these issues.
Great, thank you all for speaking. I think there was some great information for the interviewees. I'd like to invite them, if they have any questions for our panelists, to put those in the chat. And then we have some pre-submitted questions I'm going to be running through. So the first one, what support and mentorship is there for LGBTQ plus people at USIS?
I guess I can take this one. So like I was saying before, I think the support at USIS is actually insane. That's one of the main reasons why I went here, because the support isn't always like mentorship, it's sponsorship, where people push you to like succeed and strive for something better. And so I have at least 3 sponsors at school already, and I've only been here for, I don't even know, 6 months. And so within the LGBT community, we're trying to establish a more diverse network, and we've actually finally reached out to Dr. Highland, who is an assistant professor in research, I believe, and they are absolutely phenomenal. And they are a huge ally and trying to advocate, and especially with the recent trans ban revoke, we're going to be trying to changing some of our student policy to be using gender neutral pronouns and going forward with that. And so I think if you look for a sponsor, you will find them anywhere and everywhere. So I don't think there's a shortage at our campus.
The next question is, how are, if at all, are diversity in medicine and social determinants of health being incorporated into the curriculum and training at USIS? I know some of you spoke about this earlier, but if anyone has anything to add in regards to this question.
So I'm happy to take that. So with as far as social determinants of health, that's already embedded within the curriculum. I know there are small groups regarding it. They have it not necessarily even kind of in, I don't know, one reflective practice or one small group, but it's discussed within all the different sorts of modules. And also as you do your patient encounters, that's kind of embedded within kind of the teaching there as well. And as we mentioned, there are also opportunities regarding taking part in advanced clinical rotations where you can kind of do your 3rd or 4th year. So optional sort of rotations that you can do. And also with the restriction of movement, kind of like somewhat quarantine that you need to do before going into your clerkships, we have a lot of these 2-week distance learning courses that we're putting on as well. And looking at all the different, array of courses that the faculty have been wanting to put on. There's my course that I'm running, the Racism in Medicine. We have one on social determinants of health as well. And I think we have another one that speaks specifically to diversity in medicine. So there's a lot of different opportunity. And I'm sure that although we're doing these distance learning courses because we are on the virtual platform, we're doing it to kind of, provide education that way. I'm pretty sure once we get to a post-COVID timeframe that we'll be able to integrate those into the curriculum as well.
Great, thank you, Commander Saeed. The next question is, I have heard that the military can be a harsh environment for LGBTQ individuals. How is the environment at USIS, and how are LGBTQ individuals treated at residency and other military health facilities?
I'll take that one. I suppose, I don't know, I guess that's sort of a loaded question. I have only had my experience at USIS, obviously, but I'll just give a little anecdote that I remember when I was applying and I was going through the process and I had my interview at USIS, and I remember it was right before my second interview of the day, and I had these 2 fourth years just talking to me, answering all my questions. I don't know what they were doing for the day, if they had a day off, if they had like taken a personal day, but they were just answering all my questions about the military and what they wanted to go into and how they found their love of family med. They both wanted to do family medicine. And I just kept on thinking the entire time how nice everyone was and how great that they, were taking the time out of their day to sort of teach the next generation of medicine and sort of perpetuate, all the good things and pay it forward. And that's honestly how my experience has been at USIS since. Like I said before, I found some of my best friends before coming to USIS. Regardless of what branch you go into, you have to do officer training school. So there for about 4 or 5 weeks, you learn sort of the ins and outs of everything about your branch of service, how to salute, how to wear the uniform, what uniforms to wear, a bunch of death by PowerPoint kind of things, which if you have any other questions, I can answer. But you really do become a family. And that's really something I was looking for in a medical school. When I was in college, I was in a fraternity. So I really wanted sort of that camaraderie, brotherhood, sisterhood, personhood that you get sort of in that sort of organization. So me, being sort of intersectionality in all those groups, I have found that it's been really a blessing and super beneficial just to find people to connect with and people that have been supportive of everything in all my endeavors.
This is Captain Beckett again. And I echo, and I think that that's actually absolutely true. And I would say USIS is definitely that place where it's a family-oriented environment. And I would say that outside of USIS, in the larger military, there may be some encounters of real bias. And I think that the military, all services, are having to really make sure that they understand that is not tolerated. I remember don't ask, don't tell. I remember it clearly when I had patient encounters that we could not ask that question. And I remember having to explain to senior leaders that that person's sexual orientation had nothing to do with their job. And so I think that, it's not all roses, but it's not all bad either. And I do think that there are definitely champions out there, people who understand that, you're there for a job and none of that other stuff matters. And I think, and if anything, we should embrace all folks and whatever it is that they choose. And I would say, I don't know much about the Army or the Air Force, but in the Navy, particularly on ships, getting in that safe place is important. I only have been on the USNS Mercy for deployment, and we had a massive number of folks, and so everybody was there, everybody was accepted. That was ever an issue. But you know, it's definitely, I would say, almost like the reflection of the society, like someone else mentioned. You know, maybe you're gonna find someone who has a real personal bias, and you should ensure that that never impacts on your career, your assignment, your promotion, your you know, any kind of discipline. That's important, that that never comes into the picture. I've been on our we have a committee at every command in the Navy that looks at these types of issues, and I served in that role, the command manager, equal opportunity manager, and that was something that we looked at very closely. And I know that all the other service branches have that as well. But I think that the purpose of USIS is really to be that beacon, to be able to teach, to be able to bring a generation forward that has a different viewpoint than maybe some of the folks who were traditionalists. So that's just a sort of a different take on it from outside of USIS.
I have to agree with everything that's been said so far. I'm going to be honest with myself and say that when making the decision to come to USIS, I was a little hesitant and I thought that would be an issue. But once I came here, I was opened, like everyone accepted me with open arms. And as Captain Beckett was saying, that you will eventually face discriminations in the real world. But for that one bad encounter you have, I know of at least 10, 20, 30 allies on campus that are there to like support you. And I know Don't Ask, Don't Tell wasn't repealed that long ago. And even our organization is trying to talk about like the impacts that had. And so we're actually starting a lecture series called Do Ask, Do Tell, to talk about people's experiences and see how that impacts them. And hopefully that'll send more messages to other healthcare providers and say like, the way that you approach certain topics can influence the healthcare needs, and also the importance of an allyship, because after all, at the end of the day, we're trained to be leaders, both in like military and in medicine, and being a leader means to be an ally. And so even if the issue doesn't affect you personally, it might affect someone that you know, and therefore it is an important topic and conversation that you need to take on as your own.
Thank you all for sharing your thoughts on that. The next question is regarding diversity within the school's small group learning environment. Does USIS consider racial and or social economic backgrounds of incoming students when creating fire teams? I can speak to this briefly, and then if any of the panelists have anything to add. To the best of my knowledge, the small groups or the fire teams are based off of just trying to have a distribution of each of the branches represented, and then at least having one prior service. So someone with additional experience and a different background than other people coming from the civilian to now military, to help them answer any questions about military specific issues or trainings. But I don't believe there's any other considerations taken into account, if anyone has anything to add.
Yeah, not to my knowledge. I know that the groups are formed more so by, I believe the Office of Student Affairs has, they help out with forming those groups. But other than what you discussed, I don't believe anything else is really considered.
Yeah, and in addition to what Taylor said, they also try to have like an equal representation of like males and females. I think typically USIS skews like 60-40 males to females. But also, you know, you have your fire team, which is 4 people, and then your fire family, which is 8 people. So sort of in that group, there is bound to be some sort of representation and sort of diversity in terms of, you know, who your fire team and family members are. So I wouldn't worry too much about that.
The next question is, were there any unexpected challenges you faced as a minority student at USIS? How welcoming is the greater student body towards minority students?
You look like Trinity from the Matrix. Take her.
Yeah, I think I talked about that a little bit already, sort of my experience that I ended up writing about. I will say for my class, there were about 7 other Black males in the class, and that's out of about a class of 170. And I think that goes back into what we were talking about and sort of underrepresentation of, Black male students and even, Black female students and Hispanic students and Native American students. So how I dealt with it myself is I found solace in sort of like writing and doing research and talking about it with friends and mentors and sponsors and whatnot. And I think that's a very personal sort of journey that you have to go through yourself. Most medical schools are not, as representative as the sort of greater country is in terms of their numbers of minorities, unless you go to a specific, minority, medical school like an HBC or something like that. But again, I do think you find sort of your tribe and people who are supportive of you within your class or within the classes above and below you. And there's a lot of sort of interaction between the upperclassmen and the underclassmen. So there are always people and relationships to be formed.
Thank you for sharing that. The next question is, how is the diversity of USIS faculty?
So I'm happy to start off with that. So when you think of USIS faculty, we're kind of like a unique sort of school in that our faculty are not just the faculty that are on campus, but we do have nationwide faculty. So, when you look at the faculty on campus, just like, any other school, any other medical school, as far as the minority faculty, you're not going to have, as much obviously as, other faculty, but once you look at out of the confines of USU, there's always going to be, faculty kind of like available as far as like, if you don't just necessarily look at USU, but if you look at, okay, we have faculty that are on the West Coast, we're faculty at all the different MTFs that also interact with our students. So for students who, let's say, if you are a minority student and you feel that you would maybe, you're looking for a sponsor or a mentor that's another minority faculty, generally students are able to reach out to not only the faculty, like I said, that we have at USU, through some of the organizations that you can be a part of the interest groups, but also you can look for faculty outside of USU. And generally, any of the faculty are helpful with, helping you kind of touch base and connect you with faculty that are not necessarily at USU.
And I'll tag on to that. Even beyond when you leave USIS, your connections will be global and probably sustained over the duration of your career. I have friends that I met when we went to officer school that we're still close friends. We still connect. In fact, my commanding officer and I went to officer school together. And so it just becomes this enduring, I don't know, lack of a better word, friendship that you develop with people over the years through service. I've been on a deployment recently overseas, and those people will always be folks that I'll be connected to through that experience of the deployment. And so I think that even beyond USIS, I would just say that this is a special global endeavor that you would undertake.
The next question, I am passionate about mentoring minority high school and college students towards medicine. What mentorship programs exist through SNMA at USIS that I can take part of? I can speak to this briefly. SNMA definitely is interested in different opportunities with participating in the community and outreaches to influence outside of just the school. As far as incoming classes, it's always a possibility to expand on what the organizations currently do. If you feel passionate about pursuing a specific type of mentorship like this, then it's definitely something that could be set up through either this organization or other ones within the school. So there's always an opportunity for that.
So LMSA, we're restarted our chapter, so we're new this year, and we actually have a decent amount of initiatives, and we're trying to get off the ground running. And one of our huge things that at least our organization is passionate about is actually this idea of mentorship. And so we're trying to reach out to the Montgomery public school system to get into local high schools in the area and start a mentor program that way. But we're also trying to figure out ways to reach out to colleges that serve minorities and help mentor with the application cycle, because at the end of the day, AMCAS is a very privilege-oriented application cycle, and it can be pretty daunting to navigate, and especially as a first-generation college student trying to navigate even the college application, let alone the medical school application. It's extremely scary, and so having someone to help navigate through that and understand how to advertise yourself and push for your unique backgrounds to be exemplified in your application for med schools to actually understand your unique background. And so we're trying to implement that. And like I said earlier, all the faculty are super supportive. And so if you do have an initiative that you're passionate about, they'll push you and help you get in the right direction.
And I'll add, I don't know if she mentioned the S2M2 program, the science, service, mentoring, and medicine program that had been traditionally a big program that SNMA students have helped support. It's actually targeted to middle schoolers and some folks who are in their ninth grade, exposing them to medicine, exposing them to uses. Some local, some from outside of the area. And we have a recruiting coordinator who is trying to put that back together this year. You know, COVID made that program not happen this past year, but I've been involved with the S2M2. I've also been on many recruit events for the school at high schools and tried to make sure that, you know, I have been available as a mentor to people who are seeking mentors, particularly those of color. And so I think the school and through SNMA in particular has really tried to support those types of initiatives. And so I think this year's S2M2 is being planned. And if you come to the school, you certainly would be needed. So.
Just to piggyback off that, hey guys, my name is Ensign Kadimutoni. Sorry about being super late. I had the dates planned. I had the wrong dates in my head. I thought this was supposed to be on Friday. And sorry about the background as well. The second years are currently transitioning from pre-clerkship to clerkship. So a lot of us are moving and getting ready for our clerkships and ROM and all that fun stuff. So super excited, but sorry about being late. So to piggyback off that, we do have S2M2, I believe that's what it's called. And I was part of the leadership team with that, with Katie Lee and Dr. Patrick Santiago, who is our diversity lead at the university. And we had a great plan. We're gonna have the kids go into the OR and have poster presentations kind of like they do every year. But unfortunately, COVID did happen and we had to cancel that. And since I'm going on clerkships, I won't be part of that group. But I think the next incoming students, you guys can all participate in that. That will boost up your CV and you just get to reach out and talk to a lot of students. I say boost up your CV because step 2 CS is gone and step 1 is now pass fail. So like the more things you can do, the better in general. And I'd also like to say that one of the things I really liked about SNMA was kind of like the continuity that you have with that. I led I got to facilitate anesthesia interest group as well as internal medicine interest group. And unfortunately, the way that works and with how busy your student schedule is, you kind of give that up at the end of the year. And so every year you switch leaders. But with SNMA, the group stays the same. Like we're still in the same group me, all of us together, and we can always ask questions to the third year. So one of the things we did very recently was SNMA had a panel of third years and fourth years that had already gone on rotations, explaining to us students that are about to go into rotations, like what we need to bring, what we need to be aware of, different ways to study, like just our within SNMA. That was really, really nice. We got some really, really personal feedback and also mentorship. They were like, yeah, just contact us if you're at this rotation or you're going to this hospital. If you're going to San Diego, I went to San Diego too, just shoot me a text if you have any questions. And that was really good. I really enjoyed having that. So yeah, just my 2 cents for now.
I will also say just very quickly, I did the S2 M2 program back in the day, 2018, after my first year, and it was really rewarding. I was a camp counselor back in high school, so it's like kind of the same feel all over again. The kids were really, really thankful, and it felt really rewarding to see like their growth and all their activities throughout the week. And we did all those things that Caddy was talking about. They went to the OR, they did poster presentations. So I hope it comes back, because it felt like it was a really good experience for them.
So that is all of our pre-submitted questions. I want to provide an opportunity right now. If any of the interviewees have any additional questions, feel free to ask them at this time or throw them in the chat so we can address those questions. And if the panelists have anything additional they'd like to add at this time, that would be great.
Hi. Hi, I think I submitted my question too late for it to be added, but I wrote about whether there's any initiative at USIS to work towards sponsoring prospective medical students and looking at ways to sponsor students who are having financial issues with the whole process of applying to medical school and post, during residency and USMLE. There's costs associated with everything. So I'm curious if there are any current programs or plans to get involved in that space.
So I'm happy to initially take that. I'm actually working with one of the medical students in the class of 2023. So she did a research project where she kind of just really did qualitative research where she kind of looked at not only got a sense of the experiences of some of the underrepresented minorities that we have at USU, but also from that, got from that actionable items what they would recommend to improve diversity at USU. And that actually came up. So that's one of our action items that we're working on. How do we help out with a pipeline of sorts? How do we help out with supporting folks who are interested? And even just on my, just personally, I take it as my mission to kind of expose, all sorts of different populations to not only USU, but just the concept of military medicine. When you think of the percentage of the US population that's actually served in the military, it's not that many. So when you think of folks who don't have that military background or they don't have somebody in their family who has gone through that process, it seems a little bit daunting, and it seems a little bit of, well, maybe that's not really an option or opportunity for me, but kind of dispelling some myths and just providing the support that they need to kind of get through. So hopefully, it does come to fruition in the next year or two that we're able to make that happen. But for right now, the pipeline that we already have that's worked out is the enlisted to medical degree program. So we do have a pipeline for our enlisted cadre, the ones that are selected for their service to kind of do the EMDP2 program and get the sponsorship and get the resources, hopefully, to be competitive, to be able to apply to medical school, whether it be USU or somewhere else. But yeah, definitely we'll keep that in mind, and hopefully that, like I said, happens within the next year or so.
Thank you.
And I think you mentioned USMLE. I'm not too sure. I'm assuming you're talking about step 1 and step 2. But
yeah.
As far as I'm concerned, or as far as I know, those exams are free to students. Like our instructions, we haven't started taking it yet, but our instructions are literally to sign up and then not to pay anything, that will get taken care of. So all we have to do is sign up and then the school will pay for it, which is one of the awesome things, because those exams can cost a lot of money.
I will say, even on the other side, when you finally get through, Your board exams will also get paid for. So all of that, essentially, if you decide to become a physician, you'll be, taking tests for the rest of your life. And those tests are expensive. But generally the board exams and all those things are covered as well. They're either reimbursed or they'll go ahead and cover it up front.
Yeah, and I would even say, my experience was not USIS, it was HBSP, once I was on the scholarship, all the tools I needed were at my disposal, and I think that was a great benefit of the military service. I mean, even now though, if I want to take say a review course, because I still take boards, it is out of pocket, but the salary is more than enough. I also think that there's sort of a myth out there that our salaries are far below civilian salaries. I think it depends on the specialty, but you'll be compensated appropriately. And as a medical student at USIS, far better than any other students that are out there in their residency, because they're not getting a salary. So, and I think that is nice to think of a way to really support others who may not have that benefit. But once you're in, it really should not be an issue.
Yeah, I agree. I just want to echo what Dr. Beckett was saying. I think sort of our support and monetarily is a huge benefit coming from undergrad. I had some student loans and I didn't want more student loans, hundreds of thousands of dollars. So the fact that USIS, paid us and took care of any, tuition was a huge factor. And I think coming from a first generation, college student and family, and none of my family would be able to support me in terms of, medical school and college. I think that was a huge factor. And that was definitely one of the reasons that made me consider USIS, and one of the reasons why I'm here to this day. So should definitely be considered if that's something you're concerned about.
Yeah, same here. I know you've gotten a lot of answers there, but one of the things that I was also worried about was, for example, if I wanted to go into a specialty that was either family medicine or pediatrics, because I'm studying in those, I know that the debt would still be the same if I went to a different school. I would be hundreds of thousands of dollars in debt, but I wouldn't be making as much money as, say, an orthopedic surgeon or something. And so I didn't want that to play a factor in my choice of what specialty I wanted to go into. I wanted to choose whatever specialty I wanted without thinking about the money. And so with USIS, because I'm not thinking about how much debt I'm gonna have and how much money I need to make to cover that debt, and so I'm not in debt for the rest of my career, I like the fact that with USIS, I don't have to think about that. I can literally go into whatever specialty I want and not think, oh no, how am I gonna get out of this debt? Hope that makes sense.
Yeah, thank you all. The more perspectives, the better. So it's not a problem.
I will also say that one of the best things was during orientation when we picked up all of our textbooks for your 4 years, which if you do end up coming here, make sure you bring some heavy duty suitcases, because there are hundreds of pounds of books that they just give you. And I know in undergrad, I was constantly frantically searching for online versions of textbooks that were thousands of dollars. And my education probably took a hit from that. But at USIS, they make sure that you have all the resources you need to succeed. And additionally, there are secondary resources that I'm sure some people are hearing about, like Sketchy and Boards and Beyonds and stuff like that. While those aren't necessarily covered, because you are making a salary, it's not necessarily always the question of do I really take this hit to further my education? And so it is not so much of a debate as I definitely experienced in undergrad.
Thanks.
Does anyone else have any additional questions they'd like to ask? All right, so all of our panelists' contact info is up there, so feel free to reach out and email any of them, including myself, if you have any additional questions. regarding this topic or anything else when making this decision to come to USU. This will conclude our panel for the evening. I'd like to thank all of our panelists for joining and sharing their thoughts and experiences about the school. And I'd also like to thank all the interviewees for submitting questions and for coming and listening to our panelists. We hope to see all of you here next year as the class of 2025. Thank you.
Thank you.